Welcome to 10 Daily Medical Questions. In today's video, we are going to cover everything you need to know about aneurysms, from definitions and types to causes, common locations, symptoms, diagnostic tools, treatment options, and some important special cases like Marfan syndrome and Loeys-Dietz. Let's get started. Definition: an aneurysm is a localized pathological dilation of a blood vessel, usually an artery, that exceeds 50% of its normal diameter. It's caused by a weakening of the vessel wall, typically affecting the tunica media. Aneurysms are classified by shape into saccular, which forms a sac on one side, and fusiform, which are symmetrical and spindle-shaped. Types of aneurysms: we can categorize aneurysms by their location, etiology, and shape. By location, the most common are abdominal aortic aneurysms, thoracic aortic aneurysms, peripheral aneurysms such as in the popliteal arteria, and cerebral aneurysms, often called perianeurysms. By etiology, we distinguish between true aneurysms involving all three vessel wall layers and false aneurysms or pseudoaneurysms, where a rupture is contained by surrounding tissue. Most common locations: the most frequent site of aneurysm formation is the infrarenal segment of the abdominal aorta. Other common locations include the popliteal artery, thoracic aorta, and the circle of Willis in the brain. Causes and risk factors: aneurysms develop due to a mix of degenerative, genetic, and acquired factors. Common causes include atherosclerosis, chronic hypertension, smoking, and age-related degeneration. Some patients have genetic predispositions. Conditions like Marfan syndrome, Ehlers-Danlos type 4, and Loeys-Dietz syndrome are associated with early onset and more aggressive aneurysmal disease. Other contributors include trauma, infection, and inflammatory vasculitis. Popliteal and abdominal aneurysms. Important association. An important clinical point: when you find an aneurysm in the popliteal artery, there's about a 50% chance that an abdominal aortic aneurysm is also present, and vice versa. So, when one is diagnosed, screen the other, usually with a duplex ultrasound. At-risk populations: abdominal aneurysms are especially common in older men, typically over 65, particularly those with a history of smoking or hypertension. Popliteal aneurysms also occur more often in elderly men and are frequently bilateral. Symptoms by location: most aneurysms are silent until complications arise, but when symptoms do occur, they vary by location. Abdominal aortic aneurysm may cause a pulsatile abdominal mass, dull back or flank pain, or symptoms of rupture like sudden severe pain, hypertension, and shock. Thoracic aneurysms can cause chest pain, cough, hoarseness, or difficulty swallowing due to compression of nearby structures. Popliteal aneurysms may cause leg pain, distal embolization, or mimic deep vein thrombosis. Cerebral aneurysms, when unruptured, are often silent, but rupture leads to a subarachnoidal hemorrhage presenting with a sudden thunderclap, headache, neck stiffness, nausea, and photophobia. Genetic syndromes, special patients. Let's talk briefly about some important inherited conditions. In Marfan syndrome, aneurysms typically affect the ascending aorta with a high risk of dissection. Ehlers-Danlos syndrome, vascular type, causes fragile vessels prone to spontaneous rupture, even at smaller diameters. Loeys-Dietz syndrome leads to aggressive aneurysm formation and arterial tortuosity. These patients often require early surgical interventions. Diagnosis. Diagnosis starts with imaging. For abdominal or popliteal aneurysms, ultrasound is often the first step. CT angiography is the gold standard for detailed preoperative planning. MR angiography is used especially for thoracic or intracranial aneurysms, and digital subtraction angiography is mainly reserved for cerebral aneurysms. Treatment options and indications. Treatment depends on aneurysm size, location, growth rate, and symptoms. Small asymptomatic aneurysms may be managed conservatively with regular imaging surveillance, blood pressure control, and smoking cessation. Surgical options include open surgical repair, durable but invasive, and endovascular aneurysm repair or EVAR, less invasive and often used in high-risk patients. Indications for repair include AAA greater than or equal to 5.5 cm in men or greater than or equal to 5 cm in women. Rapid growth over 0.5 cm in 6 months or symptomatic aneurysms. Popliteal aneurysms should be repaired if symptomatic or larger than 2 cm. Screening guidelines. Screening is essential to catch aneurysms early. A one-time abdominal ultrasound is recommended for men aged 65 to 75 who have ever smoked and first-degree relatives of AAA patients. If a popliteal aneurysm is found, always screen both legs and the abdominal aorta. Complications to watch for. Major complications include rupture, especially in AAA. This is a surgical emergency. Dissection, particularly in thoracic aneurysms, thrombosis and embolization, which are common in peripheral aneurysms, and compression of adjacent structures depending on location. Recap and takeaway. To wrap up, aneurysms are dangerous but often silent. The most common site is the infrarenal abdominal aorta. Popliteal and abdominal aneurysms frequently co-occur, so always screen both. High-risk patients include elderly men, smokers, and those with connective tissue disorders. Early detection, monitoring, and timely intervention can save lives. Thanks for watching 10 Daily Medical Questions. Don't forget to like, subscribe, and leave your questions in the comments below. See you in the next video.